Hi, I'm Dr. Katie Schaefer, one of the pediatricians at South Lake Pediatrics. At South Lake, we work hard to be the leading provider in healthcare initiatives in pediatrics for the state of Minnesota. Today, we're continuing our parent education program with a conversation with Dr. JoAnne Hoffman. Dr. Hoffman is a pediatrician with over 26 years of experience in child development and mental health care. She's the director of our mental health services here at South Lake Pediatrics, as well as a member of the board for the Prairie Care Fund, which supports healthcare initiatives for our youth in our schools. She's a wonderful teacher, and we're looking forward to hearing her talk entitled Aches and Pains, Worry and Stress. Is it physical or mental? Welcome, Dr. Hoffman.
Hi, I'm Dr. JoAnne Hoffman Jecha, and I'm here today to talk to you about how our minds and bodies seamlessly interact as a whole person. Unfortunately, somewhere along the line, having symptoms that could be classified as mental became shameful or something to hide. If you have pain, you get sympathy. If you have depression, you need to buck up. Thankfully, this stigma in society is changing, but we have a long way to go. If we can't acknowledge the link between mental illness and wellness, with physical illness and wellness, and learn to understand this interplay, we may miss some of the best ways to be truly healthy and whole, body and soul. This physical and mental interaction can be seen in the most primitive of responses, the response to danger. So if I'm a cave woman, I'm holding a big leg of lamb over a fire and a tiger's coming, what do? Well, I really only have three choices. I can fight, I can run away, or I freeze. Kind of deer in the headlights phenomena. While the intensity of the responses is occasionally helpful in the 21st century, most of the time it's too much, and yet it's triggered nonetheless. As parents, we may be able to respond to the behavior, a meltdown, or the physical symptom, a stomach ache, but may not see what the underlying cause actually is. The fight, flight, freeze response can show up in many ways. Physically, when the body's in a fight or flight mode, the muscles become tense, the respiratory rate increases, the intestines become active, the brain becomes hyper aroused and on hyper alert mode. This can show up as headaches, stomach aches, diarrhea, tight throat, shortness of breath, problems sleeping, loss of appetite, racing thoughts. Freeze can result in excessive sleepiness, overeating, stomach aches, constipation, feeling weak, or feeling dull. There may be refusals to do homework, fights about going to school, attitudes of defiance. I don't care, it doesn't matter, leave me alone. There may be poor concentration or lack of motivation, apathy, feelings of being overwhelmed or stuck. There's so much to do, they don't know where to start, unable to start. Socially or within the family, you might see arguing or irritability over the smallest of things. There could be less joy, more tears, more retreating to the bedroom, avoiding seeing friends, avoiding spending time with family, wanting to quit activities. We also see cravings, they're very common. So, cravings in particular for carbohydrates. So, there's a good reason why carbohydrates are called comfort foods. So, you eat a nice dish of pasta and it feels good, and your energy increases and you feel alert. But guess what? The insulin kicks in, the blood sugar starts to drop again, and then we feel bad again. And guess what? We want more, but we didn't actually net any improvement. You can also see cravings for some sort of continuous feedback to interfere with our thought loop. In the past, it probably was a little bit more in the terms of books or reading, which is great. But again, we can be lost there. Now, it's probably more video games, streaming YouTube, streaming Netflix, looking at social media as a way to kind of block out what's going on. That's also a vicious cycle. Having these symptoms does not necessarily mean there's something wrong. We're responding in a very real way to a very real stress as we perceive it. In many situations, the mind and body overreact in ways, though, that we cannot understand or manage. These symptoms of your kids may trigger similar symptoms in you. Irritation, frustration, sadness, hopelessness, and fear are all normal feelings for a parent to have. It's very difficult to look at your kids objectively when your own emotional responses are triggered. My sister used to always tell me to get off my kids' roller coaster, emotionally speaking. I'd like to spend a few minutes talking about the effects on the body of chronic stress. I'm referring to chronic emotional distress and the effects on the mind of chronic physical pain. There's a whole field of study about how the environment and our life experiences interact in combination with our own genetic makeup and potentially cause not just physical symptoms, but actually physical illness over the course of a lifetime. This is called epigenetics. When I say stress, I'm referring to all sorts of emotional distress: anxiousness, sadness, hopelessness, fear, panic, as well as the duress that comes with something more significant like the death of a parent, or divorce, or physical or emotional trauma. The later are known as adverse child events, or ACEs. And there's a lot of field of study on the implications of these ACEs. The simplest physical results of stress to understand are symptoms like headache or back pain. The more time the body spends in some degree of fight, flight, or freeze mode, the more likely and more frequently the body's going to feel it. That tension in the muscles can lead to headaches, back pain, and neck pain, even if we don't recognize it as such. A similar pattern occurs with all manner of stomach aches, stomach pain, diarrhea, heartburn, or constipation. That anxiousness and the state that it puts our bodies in can trigger those types of symptoms or make them worse. Recognizing that there's a role for stress in these symptoms can more quickly help us to provide relief. Do you see what I'm saying? Not only that the physical causes mental distress, but the mental causes physical distress. They're fully entwined and can't be separated. Studies show us that chronic emotional distress significantly increases the risks for diseases like heart disease, stroke, cancer, and diabetes. Chronic stress can actually shorten your lifespan. It's a fact. The more severe and the longer the duration and the less protective factors you have, the greater the risk. Scary stuff, but guess what? The point is not to scare you, but to motivate you to action. Hang in there, and I'll get to what you can do for you and your kids. By now, I don't think you'll be surprised to learn that chronic pain or chronic illness in general is a huge trigger for depression and anxiety. Think back to the effects of fight, flight, and freeze on our bodies. The muscle tension, the increase in heart rate, the stomach pain, etc., all tell our minds that we're under attack. We have something to fear. We have cause for alarm. In this situation, the physical symptoms telling us to be anxious and fearful, the thoughts of what's wrong, will it ever go away? Is my life ever going to be back to normal? What if the pain happens at school? What if I need to throw up? I don't think I should go to school. I don't think I should go to basketball. The subsequent withdrawal from activities and friends sort of enhances the cycle, increases the feeling of needing to withdraw. Can you see it now? The pain leads to anxiety. The anxiety leads to more pain. The pain leads to more anxiety. Now you have your pain-anxiety cycle. There are situations, for sure, where there's chronic pain. But even then, the emotional response can make the experience of pain worse, taking away the joy of life. The cycle can be broken by managing the emotional consequences of pain to get back to where the body and the body alone says the pain should be. It allows us to push the pain to the back of our minds, to not have the pain be the focal point. It's not all in your head, but your head is definitely making it worse. Again, scary stuff, but there is hope. When should you seek help? If you're considering that question, it might be now. The key word, though, is impairment. When there are effects on academics, family, or social life that's persistent over a period of several weeks, months, help is needed. When you see lack of joy, anger, irritability, tearfulness, or withdrawal, help is needed. When there are persistent headaches, stomach aches, fatigue, or sleep problems, help is needed. Make observations. I notice that you're spending a lot more time alone in your room. It worries me. You seem more down. Can we talk about it? And listen. Tell me about your headaches. Do you have some ideas of what might be making it better or worse? Don't be afraid to ask the tough questions. Some people feel so badly that they want to hurt themselves. Do you ever feel that way? Have you ever wanted to die or wanted to kill yourself? If the answer is yes, you need to ask more. And if there's intent or a plan, it's an emergency. Okay, it's a lot to absorb here. Let's talk about two things that all families can actually do. First, establish a healthy lifestyle. Second, we can push on the walls of our comfort zones. Everyone, meaning the entire family, can benefit from lifestyle changes. It turns out that having a healthy lifestyle is the number one thing that you can do to both treat and prevent mental and physical illness. It can actually lead to a longer life. You can use this idea of epigenetics for a better outcome. Healthy lifestyles include nutrition, exercise, sleep, time outdoors, disconnecting from media, finding a passion, increasing your community, social connectedness. This is more important than genetics, than an environment, or than socioeconomic class. Dr. Julia Wasik will speak on ways to improve your healthy lifestyle in a separate talk. Next, let's consider the concept of a comfort zone. This is your comfort zone. Inside here, often it's your home, your family. It might include sports, or it might include school. And what we do in order to grow is to push on the comfort zone. Maybe it's going to camp, maybe it's trying out for a new team or doing a sleepover. It's just being able to go to school when there's a stomach ache. When you do that, you push on the walls of the comfort zone, and it gets bigger, and your comfort zone grows and grows. But when we avoid those things that are hard or that are difficult, it actually shrinks. It gets smaller and smaller. So less and less does it take for you to feel that stress or that pressure, or even triggering that panic that we talked about with fight, flight, freeze. The point here is not to avoid what causes stress. Going to school, despite worrying about getting a stomach ache or trying out for that team or ordering at a restaurant, whatever it is, the more we do it, the safer it feels. Outside help may be needed to do this, but it typically starts small and gradually do something that's more and more challenging. And with that, the comfort zone will begin to grow. By directly and daily addressing our health in real and tangible ways, we can combat the fight, flight, freeze response. We can improve our physical and emotional health, or our whole health. What else? Well, your child is part of your family. Managing your own anxieties and emotional health is essential. Everything that I've said today applies to all of us as parents as well. Cultivate those protective factors. Protective factors include close relationships with caring adults, identifying and encouraging a sense of purpose and meaning in life, or a passion, sports, art, volunteering, music. Learn self-regulation through social-emotional skill development. Promote social connectedness through activities, involvement, friends. Educate yourself just as you're doing right now. We have some experts to help you in our parent education series. Dr. Katie Holter will help you understand the importance of a full range of emotions and of developing resilience. Dr. Sam Marzouk will give you great advice on parenting defiant children. Ashley Christ, a licensed social worker and therapist, will help you teach your children emotional regulation. There are many websites and books that can help as well. Seek help. Start with your pediatrician or your pediatric nurse practitioner here at South Lake Pediatrics. All our clinicians are trained to help assess what might be going on with your child and to help you make a plan. If ultimately medication's appropriate, we are all trained to help with this as well. Call your school. School staff and teachers do want to know what's going on. They do want to help. Nearly all the schools have partnered with an outside agency to receive private therapy as well, but within the school. Connect with a therapist. This will be essential. Our care coordination staff can help you to find a resource that's best for you. You can call our office and ask to speak to care coordination. In a crisis, you may need to call 911 or go to the emergency department, and our website can help you with crisis resources. There are many wonderful websites and apps that can help you too. A list of some of these options can be found on our website in connection with the links for this and other talks. South Lake Pediatrics is here and ready to help. Call us at 401-8300 or visit our website at southlakepediatrics.com. Thank you for joining me today. Stay tuned for more great pediatric talks coming your way.